Welcome to the first of many lectures about pediatric cancer. Here is a list of the most current statistics related to the incidence of cancer in children. And you can see that our blood cancers are the most common. In the younger children, we're looking at leukemia, and in our adolescent population, a lymphoma is more common. And then there's a long list of a variety of types of cancers. And we're going to talk about most of them throughout the lectures. The good thing is that 8 out of 10 children usually survive their cancers. This slide came from Seattle Children's Hospital, and what they did is compared their results to national. So when we're looking at Hodgkin's lymphoma, we have a pretty decent chance that this child's going to survive. And when we look at survival rates, we're looking at 5-year survival rates. Our ALL, which is the most common cancer, is 79% nationally. When I initially began pediatric nursing practice in the early 1970s, these numbers were very different. We had about a 20% survival rate, so we've come a long way. Brain cancers, about 70% of children are surviving those cancers. Then when we look at some others, a Wilms tumor, which is a kidney tumor, great survival rate. And what's amazing is even when these children come in with stage 3 and 4 disease, they do fairly well. Thyroid cancers do very well. Neuroblastomas, about 70%. And we're still working on the bone cancers, and those are the osteosarcoma and Ewing sarcomas. And they're associated with a great deal of morbidity as well as mortality. The thing about pediatric cancers is the child comes in, there's a suspicion, we run a lot of tests. And there's a very short time frame between coming in, diagnosis, and initiating treatment. The diagnostic test for pediatrics is very much the same as those for adults that you learned about in 172. So we look at our serum markers, and that would be our blood count, the chemistries, and then tumor markers, as in AFP markers and CEA levels. When we do radiology tests, we have CT scans, MRIs, PET scans, which will tell us about the metabolic activity of the tumors, and a variety of other nuclear testing. And then we look at lumbar punctures, and the purpose of the lumbar puncture is to see if there is central nervous system involvement. In addition, we do bone marrow aspiration. We can directly biopsy a palpable mass, and then some of them, we know that they have a mass, but we don't know if it's cancer or not until they go under anesthesia and they surgically will explore the area, possibly resect it if possible. So our job is huge in terms of preparing the child and the family for what they're about to endure. Of all these tests that are listed here, some of them are going to require conscious sedation. The lumbar puncture, bone marrow aspiration, possibly the biopsy depending on the age of the child. And some of the radiology tests may require a form of sedation, not conscious sedation, but just to sedate the child long enough so that they can lay quietly to have the test be performed completely. And here is a picture of a child getting a lumbar puncture. And this ends part 1.